Welcome to the 372nd of the COVID calls. This is a daily discussion of the COVID 19 pandemic with a diverse collection of disaster experts. My name is Scott Gabriel Doles. I'm a historian of disasters at the Korea Advanced Institute of Science and Technology. I'm coming to you live from Daejeon, South Korea. Today, I welcome Dr. Vipul Shah, the medical director of the R.P. Shah Memorial Trust Against COVID 19 in Lucknow, India. Just a reminder, you can usually catch COVID calls live on weekdays at 6 p.m. Eastern Time. Just go to the COVID calls YouTube channel to watch. This is a special COVID calls at 5:30 p.m. Korea time. You can hear COVID calls anytime, recorded as podcasts on Spotify, iTunes, Podbean, or anywhere you get podcasts. You can also keep up with COVID calls via Twitter using the handle at US of Disaster or at COVID calls. Please help spread the word and send suggestions for future guests and future topics. Please feel free to suggest yourself as a future guest. As of today, November 4th, 2021, there are 5,022,082 deaths from COVID 19 globally. That's according to the Johns Hopkins University Coronavirus Resource Center. South Korea reports 2,916 deaths, just as the country is entering a new phase, which it calls with Corona, be opening up more than it has in previous months. The nation of India reports 459,191 deaths from COVID 19. I've been reading an obituary or a story of advocacy for those impacted by the pandemic. I'd like to continue that now. The headline is "The Devastation Caused by COVID Calls for a Reinvention of the Obituary." This appeared in the Indian Express and was written by Amrita Dutta. It appeared July 28th of this year, 2021. In the months since the pandemic began, my colleagues and I have written, commissioned, and edited numerous obituaries, writes Amrita Dutta. Those who went too soon, others who were not deceived by time. Not all of these deaths were due to COVID 19, but they have felt part of a greater relentless toll. Most journalists on an obituary deadline dwell little on the fact of death. They are keener on the right anecdote, the elegant line. I think of the obituary as a celebration of life, said Anne Rowe, the obituaries editor for The Economist, known for immersive portraits of politicians, generals, singers, and actors. In death's departure, the defiance of the living is that we look back by staging a life in 1,000 words, by retelling the singular joys and quirks of a person's life. An obituary of Marcel Proust told us that, quote, his apartment in Paris was lined throughout with cork in an ineffectual attempt to keep out the uproar of the noisiest city in the world. Obituaries, spiky with criticism, even malice, are important. They are antidotes to easy pieties and return us to the messiness of life. A journalistic detachment, or the pleasure of a good copy, is harder when you are as much a part of an unfolding tragedy as those you write on. When you have stayed up in dread at the sound of ambulance sirens, when you have lost friends and family, when the writing has been knocked out of you by fear. What is this day? One of us exclaimed recently, on a day bludgeoned by news of the deaths of Sarika Sikri, Gautam Benegal, and Danish Siddiqui. In the early months of the pandemic last year, the obituary had felt like an intimate, consoling genre. It made space for the sorrow that had become heavy and inarticulate with isolation. As eyes used to the glare of day learned to see the shades of twilight, it made us aware of a shared mortality, otherwise a blur in our frenzied everyday. Last year, as the COVID toll mounted, newspapers in the West commissioned obits of ordinary people, and not just public figures, who died of COVID 19, a way to comprehend the scale of an exponential tragedy. The New York Times series, Those We Have Lost, ran until June of this year, profiling 500 COVID 19 victims. They stood in for the staggering number of victims whose lives we could not possibly recount, said series editor Daniel Wakin. Who have we in India lost? In Gujarat, pages and pages of paid death notices in local newspapers became a way for journalists to question the official death toll. The debate over undercounting COVID deaths is an ongoing one. Some estimates of excess deaths put India's COVID-19 death toll near 4 million. This article again appeared in July of 2021. And yet the dead, those we have lost, risk becoming a faceless plural, their humanity buried in statistics. The obituarist's impulse to remember and rescue a life from oblivion is up against a brazen denial. The government's reply in the Rajya Sabha that no states reported oxygen deaths anywhere in the country is just one example of how power is wielded against collective lived experience. There has been no acknowledgement, forget accountability, for the central and state government's brutal abandonment of citizens during the second wave. Prime Minister Narendra Modi has congratulated the chief minister of a state in which the COVID dead were flung into the Ganga or buried into the shallow sand on riverbanks for his outstanding work in dealing with the second wave. Can the debate over excess mortality alone lead us to a reckoning if we dare not speak of our excess grief? For despite divisive politics and the fractures of caste and religion, this is the common ground we stand on. Too many of us have died, their obituaries unwritten. RJD MP Manoj Jha's moving speech in the Rajya Sabha was a rare acknowledgement of this collective loss. The monsoon session, he reminded fellow parliamentarians, had opened with a listing of unprecedented 56 obituaries. Look for the figures in your own pain and loss, he told the House. It might be naive to expect other politicians to follow him, to open up Parliament to a collective testimony of loss. Ordinary lives, we know, are worth little in this country, the author writes. We have struggled to come to terms with memories of collective trauma, such as the partition, though we wield it easily as a weapon. The 1918 Spanish flu pandemic led to 20 million deaths in the subcontinent and is scarcely remembered. Between devastation and resilience, though, lies the work of the memorialist, perhaps an artist such as Svetlana Alexievich, who has forged literature out of collective memories, retrieved the splintered truth about war and trauma through countless interviews with little people, can show us the way. In my books, these people tell their own little histories, and big history is told along the way. We haven't had time to comprehend what already has and is still happening to us. We just need to say it, she said in her Nobel lecture. Will the obituarist listen? The article was "The Devastation Caused by COVID Calls for a Reinvention of the Obituary." It appeared July 28, 2021 by Amrita Dutta. Okay, I'd like to turn to my conversation for today, and let me introduce my guest, Dr. Vipul Shah. Vipul Shah is the medical director and consultant for pediatric orthopedics, pediatric spine, and scoliosis at the R.P. Shah Memorial Trust for Children with Disabilities in Lucknow, India. He's the medical director also of the R.P. Shah Memorial Trust Against COVID-19. A graduate of GSVM Medical College in Kanpur, India, he's also patient care coordinator for UNICEF. He was, among many honors and global works that he's done in medicine, he was the first non-American candidate to win the prestigious CART Fellowship of the American Academy of Cerebral Palsy and Developmental Medicine, and he's a member of the American Academy of Cerebral Palsy and Developmental Medicine since 2017. Dr. Vipul Shah, thank you so much for joining me on COVID Calls today.
Thank you. It's been an honor.
I'd like to start out the way I usually do, find out where you're calling from and what does the pandemic situation look like there today?
I'm calling from Lucknow, Uttar Pradesh. That's not too far from Delhi, like 45 minutes flight from Delhi. It's Uttar Pradesh is the largest and the most populous state in this country, in India. And currently we have, an ebb in terms of the number of COVID cases that we are seeing in Uttar Pradesh. But there are pockets of increased numbers in Kerala, which is down south. So we are enjoying the ebb, but we are also afraid of what comes in the future.
I'd like to ask you if you would share a personal memory of this time? I'm sure you have many, but maybe you could tell us something that really strikes you as really kind of capturing the grain of this COVID period for you.
Uh, there are some personal anecdotes that I can tell you. My wife is a gynecologist, and she is at a hospital which has to cater to 100 OPD patients every day, irrespective of what the pandemic looked like. So we were very tensed about her being exposed to the virus. And I live in a multi-generational house with my parents. That's the norm in India. So my parents are 75 years plus, and my kids are 9-year-old twins. I have the luxury to, since I do pediatric orthopedics, a lot of it is uh, are things that have been there for a long period of time and that can be done on online, with online methods. But for my wife, it was always a tension that we had. For one full year before the vaccine came in, she was in a different room, a separate room with attached washroom, away from the kids, and we used to see each other from a distance of 18 feet. There were times when my kids used to talk to her, from an adjacent room using WhatsApp and Zoom calls. It was difficult. She had her own, issues of mental trauma that she had, and so we were one of those people who were really touched by our lives were personally really touched by the advent of vaccination. We were pro-vaccinators throughout because we realized early on, before others could, uh, that vaccination is probably going to be the key to some sort of normalcy. So once the vaccination happened, we not only tested ourselves pre-vaccination for our anti-spike antibodies, uh, we also tested ourselves, post uh, vaccination with anti-spike antibodies to find out how immune we were and how immune our parents were before we allowed my wife to, come in and mingle with the other members of the family. So it was difficult. And the second part that I always remember is, uh, even after taking so much care, when the Delta wave struck in after 3 months, our worst fears came in to be true. My wife, uh, she got in the infection. She was almost asymptomatic, just a little, snuffle here and there. And then I got COVID, and my dad got COVID, and so I was there. My oxygen dropped till 93, 92. My dad's oxygen was dropping till 90. We were lying prone, and since at that point of time the Delta wave was at its peak, uh, as a physician, as a care provider, my job was also to keep the morale of the team high. So I used to pick up calls of not only members of the medical fraternity, trying to treat them. I was also picking up calls of random strangers that our medical colleagues used to send across to me. They were like 2 o'clock at night, 3 o'clock at night, and again at 5 in the morning. uh, we've been through, and that images will haunt us. Some of those patients we lost, some of them we were able to save. So there are some very poignant images that will remain with us throughout my life. And another instance that I clearly remember is, I throughout the pandemic I was walking 7 kilometers, like 10,000 meters every day, uh, 10,000 steps every day. And when I got infected, it was difficult for me to climb a flight of stairs. So I have a fair idea of how bad COVID could be.
Thank you for sharing those stories and images. Are everyone in your family is recovered and okay now? You're having long COVID
Yes,
symptoms? Okay.
I'm able to walk almost the same duration, but I still have trouble when I lie down on my back. I have some sense of uh, uneasiness when I do that. So, and on top of it, I've lost a couple of hairs. So that's the other part of long COVID.
I can also imagine you, lying prone because of the breathing difficulty. 93, 92 oxygenation is no joke. That's really
Yeah.
bad. And but yet fielding calls still. And I've talked to other healthcare providers throughout the pandemic, and your work doesn't necessarily end when you're off the clock or even when you're sick, does it?
Oh no. Oh no. I would say, I couldn't say that in public at that point of time that I have been infected, because as a member of the team which was pushing vaccinations, at that point of time it would have broken the uh, speed of vaccinations that we were trying to achieve. So there was it was known to only a couple of close friends who were treating me and keeping a tab. We had a small subgroup amongst the 10,000 healthcare workers that we have in the group.
Hmm.
So we
So I'd
watched each
like to,
other's back essentially.
yeah. I I have many questions about the work you're doing now. I guess the first one is really just about what the hospital you work at is like, what the RP Shaw Hospital is like for children, and tell us also about the Memorial Trust Against COVID project.
Okay. So the RP Shah Memorial Trust was registered approximately 11 years ago. The RP Shah Trust is named after my grandfather, Mr. RP Shah. He, when the partition happened in India, he was one of those few people who had definitely come into India a little earlier than the partition, but he was a big pusher for education and care of people who needed education and care of people who couldn't afford healthcare. So once I finished my education, I am a orthopedic surgeon. Then I trained in Mumbai, and then went to US, training further. Once I was settled, my father and I sat down one fine day and decided, we need to do something for the people and the kids, who are not able to access our services. So that's how the RP Shah Memorial Trust was incorporated. And then at one point of time, we were running 17 centers across North India. I was literally on flights. I was not spending as much time home, barely a week at home, and then the rest 3 weeks in the month, I was traveling. And then my kids were born. They were premature. Uh, my wife is a gynecologist, and still they were premature and they were low birth weight, and that changed, uh, my vision of uh, my duties towards the family. And then I started settling down a little, ensuring that we try and build a super speciality referral center in Uttar Pradesh, which doesn't have any pediatric orthopedic surgeon at this point of time. Uh, it's a super speciality. Not many people take up that job. So that's how we went up. Uh, and I was constantly traveling in trying to bring the latest technological know-how uh, back home at the least possible cost. So when the uh, pandemic struck, uh, I think I was well placed at that point of time to uh, get in people. I think the human resources were the most important thing to generate. So there's a saying, that the Battle of Waterloo was won in the playing fields of Eton, and I think there's a parallelism that I can draw here. So I did my undergraduation from GSVM Medical College, Kanpur, and I think the parallelism is that I had a close knit group of seniors and juniors and colleagues, which I could anytime pick up my phone and call them up and seek their experiences out. We were all across the globe trying to find out more about the disease. So that's how these guys, they were spread all across the country. Some of them were abroad. uh, we used to sit down for an hour every night on conference calls to try and share what we knew at that point of time, and also to ensure that we don't miss anything. So that's how we at this initial point of time, we didn't name it as RP Shah Memorial Trust Against COVID. That was way later. But we started pulling in people from all across the globe. We thought understood our core values, uh, wanted to read and discuss. So that is how, I wasn't a very regular user of Facebook. I used to like post once in 3 months or something, and then those Facebook group exploded with people, and we started posting like 30 odd posts every day, pulling in people who could help us understand.
So that use of social media, particularly early in the pandemic, I mean, we've heard a lot about social media in terms of spreading disinformation, but let's focus on the other side of it first. It seems like you built an enormous and powerful community quite quickly using social media. Were you surprised by that?
Now, I wasn't initially, because most of them were friends and friends of friends. So they were there on the horizon. But yes, I think, we leveraged the power of social media positively. There's always a positive and a negative spin to every story.
The other thing I wanted to ask you about, just coming into the pandemic. So being that you're, there working at the hospital you do, the RP Shaw Memorial Trust for Children with Disabilities, you have a special vantage point for people who may have already had pre-existing conditions or or some sort of greater likelihood, I suppose, of being exposed to the virus. Um, and and I think maybe early, and you're the doctor, so you should tell me. But how much did we know early on? How much did you know in India early on as to how the virus would spread? Did you already have a sense that the kind of patients that you see would be particularly vulnerable? When did you get a clearer sense of the
Okay.
pandemic? Is my question.
I think very early on. I'll tell you why. In 2013, if I remember correctly, we put across, based on my experiences with these children with special needs, we put across a question to ourselves. We are seeing these children every winters. They have respiratory issues. Now, what do we do about it? So we started looking at the literature, and finally we decided, let's give them influenza shots every year, flu shots every year, to look at how they respond. And we were really surprised by what we saw. The number of these children dropped down enormously, and we collected that data and presented it at the American Academy of Cerebral Palsy. And then next year we added colostrum to the same group, and it increased the efficacy all the more. Those children were able to do physical therapy. The number of episodes that they had of cough and cold, the number of hospitalizations they had dropped tremendously. So we had an idea of, these children are at risk. And other thing, we probably, at our baseline understood. uh, most parents in our experience with children with such issues come to me and they ask me, they want a clear cut answer, or how would my child be after a couple of set period of time, let's say 6 months, 8 months, 1 year. And I realized that there would be children who I thought would do well, wouldn't be doing not as well after 6 months. And there would be children I thought were hopeless, who would be showing large strides in improvement. So over a period of time, I learned to say, we are proposing to do this. This is the scientific basis of why I say this, and let's follow it up on a long term basis. I think that thought process of not jumping to conclusions right away has stood the test of time and has helped us navigating the initial troubled waters during the initial days of the pandemic. We never knew what would work. Uh, we had a fair, rough idea, I would say, not a fair idea, a rough idea, we would say, and we had to build on what we knew. So to say, for example, that the herd immunity will come at this percentage or not would
Right.
have been, wrong. So we purposely, kept the messaging truthful that we really don't know everything, and there were people who were able to accept it as, the truth over a period of time.
So, um, just to keep going along these lines, what was your advice, particularly early in the pandemic, about children going back to school, or whether or not children should be in school? I mean, this has been an issue that in the United States and Europe has been followed very closely, but I know less about the way those decisions were made in India.
I think uh, we had two uh, things going in favor of us. The first is Indians, as since I said we are a multi generational family. Most Indians, like close to like 40 to 50% Indians, especially in the tier 2 and tier 3 cities, live with their parents. So the thought process of caring for the old in family is still there. Uh, During the first wave, we were able to shield our older population very well. Similarly, for the children, since you have children and you have old people, I think it makes a big difference in terms of how you approach the same question of life. Uh, the schools closed down pretty early in the pandemic. Then there was a period of time before the second wave. Every trough in the pandemic brings with it a new set of questions. People want to take those liberties. So I think that was a question, especially in some states in India. But the second wave dropped those ideas, and we haven't had that big uh, issue since then, uh, except for some pockets of people who still feel, that they needed to the kids to go to school physically. A large part of schools have been online. A large number of teachers have been vaccinated. I think that's the good part of it.
So let's turn to that since you mentioned vaccination. And I just want to remind listeners once again that I'm talking to Dr. Vipul Shah today about COVID in India and the work at his hospital, where he was just telling us it's established 11 years ago, the R.P. Shah Memorial Trust for Children with Disabilities. So you've been very involved in vaccine education, in vaccine research, in advocacy for vaccine usage. And I want to start my first question about this is just how's the vaccination situation going there now? Are there still pockets of hesitancy, and where are they?
Okay, so I think initially when the vaccines were brought in, we had our own degree of resistance. And I think that resistance has been on political lines. Uh, I think that is not only true in India, that's there across the globe. So we made it a point that we will not uh, fall towards party lines. So as I said, the big group, even amongst medical professionals, we have people who uh, toe party lines. And when I say we, uh, I am just the face of the group. I am the face of the group because I have always been apolitical. Which party I vote for, who is my hero, that's never there on social media. So I think it's an important job, not only to be apolitical, but also to be seen as apolitical and scientific. And I think that's where we scored major gains in terms of ability to convince people that we mean business, and that's not on party lines.
So, given that, I mean, that's an important point to make, that you've been able to maintain a sort of a stance and a sense of trust throughout the pandemic. Um, what has been your message? So I want to ask you sort of like how you communicate with different groups. So, for example, healthcare workers who've had some vaccine hesitancy, how have you reached out to them?
I think the core group uh, has its own ways of dissemination of information. The basic information was there on our Facebook page, but we need to understand, there are low-hanging fruits in the vaccination uh, strategy, and there are difficult fruits to get. So I think, with the Facebook group, we were able to easily get the low-hanging fruit. Uh, the messaging has to be consistent, it has to be persistent, and it has to be, as I heard somewhere, it has to be 6 words or less. That's what I was reading in an interesting article, and has to be repeated ad nauseum. So I think we need to also understand, the group also understood early on, that who we need to identify who were the people who were anti-vaccine. Were they anti-vaccine because they did not believe the science, or they were anti-vaccine because of their political beliefs, or uh, they were anti-vaccine because they were sitting on the fence and watching others how they do with the vaccines. So as I said, we first targeted the low-hanging fruits, people who were almost ready to get the vaccine. And I think a lot of messaging happened there. We also, in our group, had people who were tabulating the stories of healthcare workers who passed away. Very early on, we started doing that. And those personal stories were shared with the group. We understood the value of vaccinations, and that's how most of the fruit was low hanging, because people understood that this is the probably the only way. And then there was a dichotomy. There were a group of people who were interested in a vaccine, but not in a particular vaccine. And I think that has a parallelism even in the US. I have been talking to friends on Clubhouse. I've been talking to people who have been vaccine skeptical, and I think that's what I have been pushing for, even in the US, that not everybody is anti-vax. There are some anti-vaccine groups, and then there are vaccine skeptics. Those vaccine skeptics are probably more afraid of the new technology that is there available in the US, and they would probably, if given the chance, they would take a Novavax vaccine instead of the mRNA vaccine. So when we saw that same issue developing in a part of India called as Tamil Nadu, I told my guys, colleagues, we also wrote to the government, if the people of Tamil Nadu do not want X vaccine, there's no advantage in pushing the X vaccine. Let's give them the Y vaccine. Let them take it. Not having a vaccine is worse than having a less efficacious vaccine or more efficacious vaccine. To my mind, it was clear early on that having a vaccine is better than not having a vaccine. So these were some issues that we, answered, and then we also realized early on that if you do not uh, thrash uh, in the social media space a story that is illogical immediately, then it grows.
Hmm.
So you have to trash it right away, and at most places, for it to die down as fast as possible.
Hmm.
Uh, because after a certain period of time, after a point, if you try and thrash it, it's going to grow larger and
Hmm.
bigger.
So that's a lot of work to do. I mean, in addition to your clinical work, you now have to be a sort of a communications manager and trying to follow social media to locate dangerous, rumors, conspiracy theories. I appreciate the way you also sort of broke that down to say, I think we don't talk about this enough, that there are some people who are waiting to be convinced, or they're waiting to see because of maybe previous experiences they've had with the medical system. There's other people who it's not about the vaccine at all. They're signaling something political, and the vaccine is just a mode of communication. They're going to tell you they don't want it because they're telling you something about who they are. Um, but you have to sort of parse all of that and then move into the social media space and refute. Did you find yourself? I mean, maybe is that something you spend a lot of your time doing?
Uh, my wife is calling social media as my second wife. Uh, I am spending close to 20 hours a day on social media, trying to grab in the best possible, information, trying to refute stories, trying to, collect information and then disseminate. And then the best part is the discussion part. I think, as we discuss the emerging evidence that we have, that helps us, strengthen the bond and the trust that our colleagues have in the discussion.
So you also have been very active in lobbying for vaccination for teachers. You alluded to this earlier.
Yes.
Um, say more about that. What's been your approach? First of all, I guess it's something you had to bring up with the government, and then you also have to convince teachers that that's a good idea. I'm curious to know how that works in India. Is it through teachers' unions or state organizations that then mandate it for teachers, or is it literally a teacher by teacher decision as to whether or not they want to be vaccinated?
I think, the decision was in several layers. Rome was not built in a day. So, early on, as I said, let's catch the low hanging fruit. There were teachers who I knew or my colleagues knew. Early on, we also realized, that doctors could be the best example towards the society. So, we have a lakh doctors, which is like 100,000 doctors in India. And we calculated that if each doctor is able to convince 100 people, we would be able to get this story across. So when we decided that, we started posting, pictures of what are getting shots, our families getting shots on social media, and we asked colleagues to make those pictures their profile pictures so that all their friends and family members could see those pictures. And we kept telling people, encourage others to speak to you about the questions that they have. So it was a rippling effect. As far as teachers were concerned, uh, every doctor is in contact with 4 or 5 teachers at least, uh, be it their own teachers, be it the teachers of their wards, or the teachers that they have as patients. Uh, we initially on told all government officials that we could, catch and we could, send across, that schools will not be open till the teachers get vaccinated, till those people who carry and ferry those students to school are vaccinated. So the school lobby was also interested in getting the teachers vaccinated. Uh, and then the two, you know, merged into each other with the coming of the second wave. The second wave was really ferocious, and it brought home the point that if we are not vaccinated, we are not going to make it. Happily for us, the percentage of healthcare workers vaccinated in India is 100%. 100%. We've been able to ensure that healthcare workers not only were vaccinated, they became the focus of our anti-vaccine crusade.
So that 100% is not possible without a strong government mandate. And um, I'm curious how that worked out.
I would beg to differ a little,
Oh,
because through various channels, we were able to, as I said, we were able to get the low-hanging fruit. The the high hanging fruit, those who were skeptical, were, we made it a point every day. For example, I would pick up my phone and talk to 10 people who I thought were skeptical and who themselves were the paragons of spreading that disinformation that the herd immunity has arrived. So, picking up the phone sometimes can help you get the low hanging fruit. And then, as I said earlier, you not only have to be neutral, but you have to be seen as being neutral. So, the advantage of being seen as neutral helped us go get those people who were skeptical because of their issues with the government, or there was a very small percentage who were concerned that the vaccines have been brought early. They were convinced by the fact that the second wave came in, and they were convinced by the fact that a growing number of colleagues across in and around them were vaccinated and did not have any trouble.
Hmm.
So we didn't
And
have a mandated government
I see.
approach.
Oh, and just following up on, I meant to ask you this earlier, but the vaccine that's being produced now in India, this is the Covavax, if I'm right, or you can correct me on
We
that.
we are probably the country with the largest array of vaccines.
Hmm.
We have the AstraZeneca, which is the largest produced. Then we have a killed virus vaccine. Then we have the Sputnik vaccine.
Hmm.
We also have, at least on paper, allowed uh, Moderna to come in, but hasn't come in as yet.
Hmm.
Uh, and then we are also producing, biological E with Texas, university, and their group, Baylor College
Right.
group, is also producing another vaccine, Novavax.
So that's
So
that's
in
Peter
addition to
Hotez's group.
Novavax,
Yeah.
yes. So that group is also producing with biological E in India. So there are a couple of vaccines that we have, and we've always said, take the vaccine that suits your thought process, but take it.
Okay. Thank you for that additional information and for educating me on that. And so, would you be willing to say at this point that everybody who wants to be vaccinated in India can be scheduled for a vaccination at this point?
Oh, oh yes. Uh, at this point of time, vaccines are available only for people 18 and above. We've been pushing the government to allow us vaccines for kids. They are, provisionally allowed, but the program has not been rolled out as yet.
Hmm.
So 18 and above, anybody can schedule a vaccination and get it. And the good part is, initially we had a small percentage of people who had to pay, or who could pay and get the vaccines to jump the line. Now the government has made it available free of cost, so that has also increased the number of people who are getting ready to get vaccinated.
So, as a physician who's a specialist of pediatrics, then you must be also very excited by the opportunity for 18 and under to be vaccinated in India. What's the timeline for that, do you think?
I think another month or so.
That fast?
Uh,
Hmm.
uh, so, as I said, we need to not only uh, present data, we also have to present as an example. So when the pediatric vaccines were being researched on during trials, I got both my kids enrolled in a trial. They are
Hmm.
9-year-old daughters, and they got vaccinated. And then the group decided that we will try and enroll as many of our own children into those trials, to build consensus and confidence in the medical community. I think that's been achieved. I think it's only a question of time. The moment we have pediatric vaccinations allowed in India, most doctors will get their children vaccinated, and that would probably help increase the number of vaccinations in India.
talking to Dr. Vipul Shah of the R.P. Shah Memorial Trust Against COVID-19 on COVID calls today. And Dr. Shah, let me ask you, every day on COVID calls, I read the statistics that come from the Johns Hopkins University coronavirus dashboard that they've created. And of course, there's lively discussion always about cause of death and attribution. It's not always so clear cut. But the issue of undercounting in India is one that has been really vexing, I think, to people. And the number that they have up right now, officially, of deaths in India is 459,191. I read that at the top of the program. How does that number sound to you? Does that sound accurate?
See, even before the pandemic, we were counting only 22% of deaths, because those 22% of deaths were happening in hospitals. They were registered deaths. So we have to take any number of uh, guesses with a pinch of salt. But having said that, I will accept that the number of deaths is higher. I will accept that uh, we need to do a little better job in counting those deaths. But I definitely do not accept that the numbers that have been paraded across the world. And I have tons of uh, parallelisms that I could probably draw. But my viewpoint is that the number is approximately like 8 lakh or something, 800,000 or something. And considering the large population of India, I think that's not a bad number. And I think a lot of it happened because of our social structure, which is not being discussed. Uh, Most of our adults, the 60 plus, were shielded like crazy, and that helped us drop the numbers tremendously and helped us control the numbers of deaths in the pandemic.
I suppose, when we talk about these death statistics, I mean, it's on the one hand, it's just about having accuracy in epidemiology, but on the other hand, it does point to the problem. You said it's sort of problem of social structure. It's problems of who's counted in what kind of facilities and who isn't counted. I guess I want to ask you a little bit more about that and whether or not you think this time will be one in which you might see reform in the Indian health system, in the medical system, in access to hospitals. I've talked to lots of healthcare providers, and people don't agree about this. And I'm sort of curious your perspective. Is this a moment which is grave enough that you expect to see reforms coming out of it?
I think, I'll give you an example. So today in the morning, today is Diwali. That's the largest festival in India. And amongst the various, people send each other gifts on Diwali. Uh, Today, one of the gifts that I received from a colleague was an air purifier. Now, that's a small, token, but it's a symbol of the change that's happening. Is suddenly, after clean water, we have a clamor for clean air. I think that change in how we approach medicine uh, is definitely there. It's not going to go away. Uh, some of people will definitely shift on to online consultation. It's easier, it's cheaper, and I agree that there are caveats to the efficacy, but there are a lot of things that can be done online. My practice is at this point of time, after the second pandemic, 2 months till after the second pandemic, it was 100% online. And then I shifted to going to the clinic once a week, and the other 6 days I'm online. I think people want to see me physically, but if I say now that I am available online for 6 days a week, there's an acceptance to the fact, and that acceptance is one huge difference that the pandemic has made. There will definitely be other changes. Uh, I think there will be changes as to how the society looks at medicine, how physicians treat people. So these some of these changes will be permanent. Others will be there on the radar and will be changes just waiting to happen.
I'm glad that you mentioned that it's Diwali, and I meant to wish you a happy Diwali at the beginning, and then we got carried. I got going on the conversation. So happy Diwali, and thank you. It's
Okay, thank you.
especially meaningful that you were willing to take some time away from family today to talk. And it's interesting, to hear you, talk about ways that medical practice might be modified, that maybe more access could be provided. Certainly, in terms of vaccination, also, we're right in the middle of this sort of global vaccination effort, and we put a lot of emphasis on skeptics and misinformation. I think sometimes we lose the bigger picture that big percentage of the world's population is engaged in a simultaneous vaccination project. It's pretty astounding when you stop to think about it for a second. So we are seeing really life-changing, I think, moves in medicine right now. It's probably really worth lingering on that for a moment. I want to also ask you about medical education at this time, and how you think medical education in India, particularly, might change as a result of COVID.
I think that's a very appropriate question. Since this government came into power, this is the Modi government, there's been an increased push to build more hospitals, build more medical schools. So the number of medical personnel that we will probably see will increase. The question is making sure that the quality of education does not deteriorate. Now, the pandemic has changed a lot of things, and one of those things that it has changed is uh, while we have more people interested in medicine as a career, and that's been happening for the last 7, 8 years in India, uh, but uh, we also need to see the pandemic has suddenly forced people in the 50 to 65 bracket to sit back and think about what they want from life. And I think a large number of people in my parallel age group are thinking of early retirement from medicine. They are thinking of how best they can, use their educational background in other vocations, and how best they can put uh, medicine away and do something else which is as lucrative. So while we have a higher number of people ready to enter medicine, there is definitely some attrition at the top, and that attrition at the top has to be prevented. Some attrition will also happen, at least in India, uh, because there is sudden, uh, demand of people of Indian origin, healthcare professionals of Indian origin across the world. For example, Australia is suddenly opening up more slots for nursing.
Hmm.
Similarly, for in the Gulf. So some of that attrition may happen, and we need to try and do the best possible.
Are you worried about that? I mean, that there will be an exodus of nurses and physicians to other countries that's seen an acute need for that as a result of the pandemic? Are there things that the government can do to forestall that?
I think I am definitely worried. There is no doubt about it. We can't wish it away. Um, the government has tried its hands at trying to stop it. A couple of years ago, I think 3 years ago, they they made it mandatory to get a good uh, conduct certificate from the Medical Council of India, which uh, they don't want to give. So thereby making it difficult for people to uh, you know relocate from India. But it's a difficult call. People want to relocate. There are also people who want to come back to India, but that process of coming back to India is a little delayed compared to the number of people who want to leave India. It's a difficult situation.
One more thing I want to get to before we wrap up today is looking ahead a little bit and the long COVID situation, which is one we don't have, I guess, a very good handle on yet. What that's going to look like. What kind of research are you engaged in that? What kind of advocacy are you engaged in that? I know you've been working with this network of yours to try to bring attention to that issue. This has been a week. I've talked to several guests about long COVID. I'm really eager to hear what you've got in the works on that particular front.
I think uh, very early on we started looking at long COVID, and the reason why I say that is we looked at the number of people who had long haul symptoms even in the other MERS and SARS pandemics. And we realized that this is not something which will go away without scarring a lot of people. So we were searching online and we started following these small groups of long haulers, and we've seen those groups of long haulers increase in numbers. One of the jobs that we did as a group was to bring that information into the common medical world. You know, Initially these long haulers were being gaslighted as psychotics or having psychological symptoms, and that was the biggest problem that these long haulers underwent. So there's now with that amount of information about the long haulers, a growing acceptance of their problems. In addition, once the vaccination was being rolled out, uh, I have a smaller subset of long haulers with which we do research. So we looked at that group and we said, let's follow up those long haulers who got vaccinated. Now, those long haulers, 50% of them stayed the same with the vaccines. 37% of them became better with the vaccines, and 13% became worse with the vaccines. Now, that has allowed us to understand and get some handle on the pathology of the long haulers. The 13% who became worse are probably those people who have an autoimmune causation of the long hauler syndrome. The 37% who became better are probably those, uh, I would put them into two groups. The majority would be people who had some reaction, persistent reaction to the traveling particles of the virus, which could be uh, corrected by the vaccines. And then there is a fear that we have in that 37% is a small subgroup, probably, which has a persistent virus still there evading host immune response. So that we want to cull out and understand better. But then there's a 50% which will not show any advantage. Now, that 50% would be the people who will not benefit as much with treatment. And I say that with a lot of fear because, if you look at 1 year follow up of long haulers, we see a mirror image of that number. 37% of long haulers have been suffering for more than a year. That's a huge number. And probably that comes from the number of people who've had some degree of permanent damage to their systems, which we cannot probably undo. So when we say we want to treat long haulers, the best treatment we always say is to prevent. Years ago, I was involved in a big battle wherein I was pushing for early treatment of autoimmune diseases. In all autoimmune diseases, there's a window of uh, wherein if you put it into use, if you put inside your foot inside the door, you will be able to modulate the body's responses. If you lose that chance and that window of opportunity, then there's no way you can prevent things from happening. And that's my fear. The prevention of long haulers has to start by accepting that COVID needs to be treated as early as possible. So, initially, I was also involved, and I'm still in treating COVID early project. Fluoxamine has been published as one drug. I know Angela Rearson, who's been one of the lead researchers in fluoxamine trial, and I also know Farid Jalali, who's been working on the serotonin pathway of treating early COVID. So what we found was that if we could probably treat COVID early, we could probably prevent long haul symptoms by preventing the immune responses to reach a level wherein they could become perpetually self multiplication,
Hmm.
multiplying.
Well, I've learned so much in this conversation today, and I hope we can have a chance to talk again. I think particularly this issue around long haul COVID is one. I really, the clarity that you're speaking and the necessity for prevention, but we're looking at a public health crisis here, and I guess is it fair to say you're going to be treating long haul COVID patients for the rest of your career?
I hope not. I hope to prevent it.
Yeah.
And I think we have anecdotal evidence amongst our group that we are not seeing as many long haulers in our group as we see in other groups. And the reason probably is we've been treating COVID early and we've been treating it hard.
Hmm. Well, I want to remind everyone that you've been listening to COVID calls, a special COVID calls at 5:30 p.m. Korea time and 2 p.m. Look Now time. And you've been listening to my conversation with Dr. Vipul Shah, who is the lead doctor of the Memorial Trust for Children with Disabilities, the R.P. Shah Memorial Trust for Children with Disabilities in Lucknow, and a master organizer of physicians and healthcare experts who've been trying to meet this global pandemic. Doctor, appreciate your time. I know you're busy and I learned a lot. Thanks so much.
Thank you.
Stay healthy, everyone. We'll see you next time on COVID Calls.